Let me take you to the Ashanti region. Some mothers of babies born with cleft lip and palate are reportedly wrapping their infants in polyethene bags to shield them from societal stigma. Health officials at the National Cleft Center in Kumasi say the trend highlights deep-rooted discrimination against affected children and their mothers. Meanwhile, government is working to integrate cleft care into the National Health Insurance Scheme and the primary healthcare system, advancing efforts toward universal health coverage.
1 in every 770 children is born with a cleft. These children are usually born with a split in the upper lip or palate when facial structures fail to fuse properly during fetal development. Breathing, eating, and talking become difficult tasks for children with such conditions. Although there are no known causes, cleft lip or palate is primarily considered a multifactorial disorder resulting from a combination of genetic factors and environmental influences. When left untreated, these children frequently experience stigma, bullying, and social isolation. The National Cleft Center, first of its kind in Africa, is changing the narrative, bridging both care and social equity associated with the disorder. Professor Solomon Obriabwa is the head of the center.
There has been situations where mothers carry their babies in polyethene bags. Yes, because they don't want anybody to know that they are bringing their child to the hospital. They don't want anybody, they think that, oh, there's some clothes that are packed. Some mothers come here with their babies in polyethene bags so that nobody will see them. So it's a big thing, it's a big deal. And what we do is that because of all these challenges, series of professionals needs to come together to take care of these children with cleft.
The facility, constructed by Smile Train, the world's largest cleft-focused non-profit organization, has provided support to more than 3,000 free primary cleft surgeries in Ghana since 2003. The organization is focused on empowering families to seek free, safe, and high-quality care through its nationwide partner network to ensure holistic support for economic and social growth. Susanna Schaffer is the president and CEO of Smile Train.
Cleft care, which includes surgery and all of the comprehensive care that goes along for a patient to have a full and successful cleft journey where they can go on and thrive. And we see that as investing in local capacity, building sustainability. Through that, we are strengthening health systems overall, but that wasn't our initial goal. It was the focus on cleft care.
Cleft care is currently not integrated into Ghana's healthcare system, prompting urgent calls for no child to be left out of the universal health coverage. Director of the Medical and Dental Unit at the Ministry of Health, Dr. Ernest Esiedu, assured of plans to incorporate the initiative into the national health policies.
In terms of the stigma and the discrimination around this, is something that we do not want to accept. And so the idea of the universal coverage, saying that leaving no one behind and making sure that health is made available to all without any financial barrier is something we are promoting. Currently, what we're doing as part of the partnerships and also to ensure sustainable financing, that the current government has proposed the free primary health care and also the Ghana Medical Trust Fund. However, in the in-between, which is the National Health Insurance Scheme that has been in existence for a while, we're looking at the opportunity of looking at some of these things. So when I get back to the ministry, these are some of the recommendations I'm going to bring back to the Chief Director.
For Joy News, my name is Emmanuel Bright Kweku.